Which findings indicate increased intracranial pressure? Select all that apply. Bradycardia. Widened pulse pressure. Irregular respirations. Diarrhea. Hyperactive reflexes. Cushing's triad, bradycardia, widened pulse pressure, and irregular respirations, indicates increased ICP. Other findings do not. Which findings strongly indicate myocardial infarction? Select all that apply. Sharp pain worse on inspiration. Chest pressure. Diaphoresis. Itchy skin. Constipation. MI presents with chest pressure and diaphoresis. Pleuritic pain, itching, and constipation are unrelated. Which symptoms indicate hypoglycemia? Select all that apply. Tremors. Cold, clammy skin. Confusion. Blurred vision. Fruity breath odor. Hypoglycemia causes tremors, clammy skin, confusion, and blurred vision. Fruity breath occurs in DKA. Which findings support a diagnosis of pneumonia? Select all that apply. Fever. Crackles. Productive cough. Dyspnea. Tachycardia. Fever, crackles, productive cough, dyspnea, and tachycardia are all associated with pneumonia. Which findings are typical in acute kidney injury? AKI. Select all that apply. Hyperkalemia. Elevated creatinine. Oliguria. Metabolic acidosis. Polyuria. AKI results in hyperkalemia, elevated creatinine, oliguria, and metabolic acidosis. Polyuria is not typically seen. Which findings indicate magnesium sulfate toxicity? Select all that apply. Hyperreflexia. Decreased respirations. Decreased deep tendon reflex. Hypertension. Seizures. Magnesium toxicity causes decreased respirations, decreased deep tendon reflexes, and hypotension. Hyperreflexia occurs in preeclampsia. Which findings indicate moderate dehydration in a child? Select all that apply. Dry mucous membranes. Sunken eyes. Tachycardia. Delayed cap refill. Bounding pulse. Moderate dehydration presents with tachycardia, delayed capillary refill, dry mucous membranes, and sunken eyes. Bounding pulse indicates fluid overload. Which findings support an upper GI bleed? Select all that apply. Coffee ground emesis, hematemesis, tachycardia, bright red stool, pruritus. Upper GI bleed signs include hematemesis, coffee ground vomit, and tachycardia. Bright red stool suggests lower GI bleeding. Which findings indicate serotonin syndrome? Select all that apply. Hyperreflexia, tremors, fever, agitation, diarrhea. Serotonin syndrome presents with hyperreflexia, fever, agitation, tremors, and diarrhea. Which findings confirm anaphylaxis? Select all that apply. Hypotension, wheezing, swollen lips, muscle cramps, hypertension. Anaphylaxis presents with airway swelling, wheezing, and hypotension. Hypertension and muscle cramps are not indicators. Which findings are consistent with a pulmonary embolism? Select all that apply. Sudden dyspnea, bilateral leg swelling, chest pain that worsens with breathing, hypotension, tachycardia. Correct answers are sudden dyspnea, chest pain that worsens with breathing, hypotension, and tachycardia because these indicate impaired oxygenation from an embolus. Bilateral leg swelling is incorrect because it is more commonly associated with heart failure. Which findings are associated with hyperthyroidism? Select all that apply. Constipation, heat intolerance, anxiety or irritability, weight loss, tachycardia. Correct answers are heat intolerance, anxiety, weight loss, and tachycardia because hyperthyroidism increases metabolic and sympathetic activity. Constipation is incorrect because hyperthyroidism usually causes diarrhea. Which findings confirm anaphylaxis? Select all that apply. Hypotension, wheezing, swollen lips, muscle cramps, hypertension. Anaphylaxis presents with airway swelling, wheezing, and hypotension. Hypertension and muscle cramps are not indicators.